So, good evening and welcome, everybody. My name is Janine Birtwistle, and I'm part of the polio team here in Great Britain and Ireland, alongside Judith Diamond, who's our National Polio Plus Advocacy Advisor, Eve Conway, who's on the Countdown team, and Keith Paver and Derek Rothwell, who are End Polio Now coordinators. So, without further ado, I would like to thank our two speakers for this evening. The main presentation is by Dr. Hamid Jafari, who is the Director of Polio Eradication for the World Health Organization Eastern Mediterranean region, and Afghanistan and Pakistan, surprisingly to some, that it actually falls in something that's got the word Mediterranean in it, but it is indeed part of the Eastern Mediterranean region. And Dr. Hamid has been so involved with the polio campaign for many, many years, and he knows Afghanistan and Pakistan very, very well indeed. So without further ado, I'd like to hand over to Hamid, and then I will introduce Masood a little bit later. So Hamid, over to you, please.
Thank you very much, Janine and Judith and colleagues in Great Britain and Ireland for this opportunity. It is always a real pleasure and extremely inspiring for us in the polio eradication program and me personally to have the opportunity to speak to Rotarians around the world, because without your support, motivation, and inspiration, we would not have made the kind of progress we have made and will not overcome the challenges that remain in achieving our ultimate goal. So thank you for this opportunity. Janine asked that I make a slide presentation. So as you know, that Global Polio Eradication Initiative is a partnership, and the 6 partners that make up the GPEI, or the Global Polio Eradication Initiative. Here you see their logos: World Health Organization, Rotary International, UNICEF, Centers for Disease Control, Bill and Melinda Gates Foundation, and more recently, Gavi, the Vaccine Alliance. So just to start with, there's a whole lot of red in this map, and these are 125 countries that were reporting cases of polio when polio eradication was launched globally by World Health Organization in 1988. After the World Health Assembly resolution, when all the governments around the world committed to this goal, even though Rotarians started the movement in 1985, and it was largely from their efforts that there was actually a resolution in 1988. And at that time, 125 countries, shown here in red, were reporting on an average of about 350,000 cases of paralytic polio, which is around 1,000 children paralyzed each day from polio virus. This is where we are today. From the naturally occurring wild polio virus, only 2 countries remain endemic for wild polio virus, which is Afghanistan and Pakistan, and that's what we will be talking about mostly today. There's one fact that this map does not show, is that when we started the polio eradication program, there were 3 different types of polio viruses called type 1, type 2, and type 3. The good news is that we have completed eradication of global eradication of type 2 poliovirus and global eradication of type 3. So both of these serotypes of wild poliovirus have been globally certified as eradicated. So we are actually looking at the remaining wild poliovirus type 1. And so this map here shows that of the 6 WHO regions, all have been certified as having eradicated all types of wild poliovirus, all 3 types. The region of the Americas was the first to be certified in 1994. The Western Pacific region was certified in the year 2000. Then the next to be certified was the European region, shown here in green, certified in 2002. Then the Southeast Asia region, that most notably includes India and Bangladesh, was certified as wild poliovirus free in 2014. Very recently, last year, less than a year ago, the African region shown here in blue was certified as free of all types of wild polio virus. So Eastern Mediterranean region is the only region, as Janine said, that includes Pakistan and Afghanistan, has not yet been certified because we still have endemic circulation of wild polio virus type 1. And this is a map of the previous 12 months. And you see that there are dots of two colors. You see red dots only in Afghanistan and Pakistan, which is the wild polio virus type 1. Each dot represents a case of a wild polio virus type 1 paralytic case. And you see the green dots that are also present in Afghanistan and Pakistan, but also across sub-Saharan Africa, from Somalia all the way to West Africa. You see that these are the outbreaks of what we call circulating vaccine-derived poliovirus type 2. And I understand that you had a presentation on this recently. I'm going to focus my remarks mostly on Pakistan and Afghanistan and largely on wild polio virus eradication. But I'm happy to answer questions around circulating vaccine-derived poliovirus type 2, because it is also quite relevant in terms of how it's affecting our global polio eradication program. So these are the two remaining endemic countries. As I mentioned, that our region is facing both the vaccine-derived poliovirus type 2 here in green, but also you see that this little brown splotch at the border of Yemen and Saudi Arabia, we're seeing type 1 circulating vaccine-derived poliovirus outbreak in northern Yemen as well. And this is again the sub-Saharan Africa that I was talking about, of the extensive CVD-PV2 circulating vaccine-derived poliovirus type 2 outbreaks. So honing in on our sort of main topic of discussion today. So these are two maps of the common epidemiologic reservoir, what we call Pakistan and Afghanistan. You see there's a long border, lots of population movement. So it's a one epidemiologic block is what we call these two countries. And the map on the left-hand side represents all of the cases of polio either caused by wild poliovirus type 1 in red dots, and the circulating vaccine-derived poliovirus type 2 shown in green dots. So we had 308 cases of the vaccine-derived polio cases in the two countries, in Afghanistan, and 56 wild poliovirus cases in Afghanistan in 2020, and 84 wild poliovirus cases in Pakistan, and 135 vaccine-derived type 2 cases in Pakistan in 2020. The map on the right-hand side are the same data so far for up to 11 May 2021. And I think you see that there is a substantial decline of both wild poliovirus and vaccine-derived poliovirus type 2 in both the countries, particularly in Pakistan. Pakistan started with their outbreak response against VDPV2 earlier than Afghanistan did. Plus, as we will hear, Afghanistan has some challenges in terms of areas where children cannot be vaccinated because of a vaccination ban imposed by the Taliban, who control those areas, and a little bit more on that will follow soon. So this is the current situation, and I think what you see is that there is a real decline in number of wild poliovirus type 1 cases. So far this year, we have only detected one case of polio caused by wild poliovirus type 1 in Afghanistan and one in Pakistan. And there are various reasons to explain this decline, including, of course, the resumption of vaccination campaigns after the pause of that was imposed by the pandemic. But we also know that we still have a lot of work to do. We are still missing children in Pakistan and Afghanistan. We have not fully vaccinated everyone and have established the kind of immunity we need to achieve interruption of transmission of this wild poliovirus type 1. We are making very strong progress against CVD-PV2 in Pakistan and Afghanistan. So just to summarize, both countries are co-infected with wild poliovirus, WPV, and CVD-PV2. And there is overall fairly high national vaccination coverage, but there are specific areas with specific challenges where there are gaps in the quality of vaccination campaigns and coverage that is achieved. And some of these areas are very densely populated. They are urban and peri-urban areas, and many of them are actually settled by migrant communities, mobile communities, and particularly communities that have been displaced. And they have come and settled in areas where they don't receive any other services other than polio. So there's growing frustration in these communities. As I mentioned, there is large-scale population movement. So both of these countries have to succeed together. If we succeed in one country only, it gets reinfected from the other side. We've seen that happen before. Afghanistan was able to interrupt its polio virus transmission, but then it got reinfected from Pakistan. And I think the same will happen if Pakistan stops transmission and if there is still transmission in Afghanistan. So they both need to succeed together. As I mentioned, there are significant issues of access for vaccination campaigns in areas that are under Taliban control. And that's largely because of some of their security concerns, given the escalation of air war in Afghanistan in recent years. Not because the Afghan Taliban are against polio vaccination. It's in fact the opposite. They have always been supportive of polio eradication campaigns. In fact, the program started in Afghanistan when the Taliban were in government. We still are working very closely with them, negotiating with them to reverse this ban. We are making progress, but it's been a long time since this ban has been in place, largely because of the security considerations that they have. And after, of course, the recent developments of US withdrawal from US and NATO forces withdrawal from Afghanistan, there is a growing uncertainty in Afghanistan around the political and the security and conflict situation in Afghanistan. There is overall high level of vaccine acceptance in both Afghanistan and Pakistan, but there are clearly communities where there is a significant amount of refusal, either overt or covert refusal, and in some places it borders on hostility. And as I said, some of it is driven by the fact that there are many displaced populations who are settled in unplanned areas. They don't get any other services, but get frustrated when only polio drops come to their doors. So the program is working to address that as well, and I'll come to that. There are, of course, significant security issues, including particularly for our frontline health workers. You've seen periodically horrific news comes when our frontline workers, either in Pakistan or Afghanistan, are attacked or are gunned down. We had a very unfortunate incident in Jalalabad where 3 of our female frontline workers were murdered in cold blood in Afghanistan. And so this is a constant security issue that we have to manage and keep our frontline workers. And they are truly our heroes. Without them, we would not make any progress. And they have the courage that despite security concerns and attacks, they are still willing to go back out and vaccinate children in their communities. True heroes. There is overall strong ownership at the national level, but this is not consistently reflected at the local level in terms of the performance of the local district teams, level of accountability for performance. So I think this is an important area where, again, Rotarians can play an important role, and more on that subsequently. We, of course, have had a significant impact of COVID-19 pandemic on the program. These countries, particularly Afghanistan, has a very fragile health system, and there was further deterioration as a result of COVID-19. And we also had a 3 to 4 month pause in polio campaigns, at the beginning of the pandemic. But the programs were again very resilient and were able to resume vaccination campaigns in July of 2020. So what are we doing to overcome these challenges? I think the first and foremost is there is a major transformation agenda to improve polio operations in both countries. Really, that results in translating the national ownership to quality of implementation at all levels, peak performance, getting to peak performance. Countries are targeting both wild polio virus and CVD-PV simultaneously. And right now, as I said, we are having, and I showed you the map that we have declining case numbers. While we should really capitalize on this opportunity when the virus is weak and down, we also know that this is the most dangerous time for the program, that it could become complacent at local level or at national level or even at the global level. And we've been there before, and now we have to be absolutely clear-eyed that we have to continue to push and still improve the kind of gaps in quality that we still have in the program to make sure that we don't miss any children. We have to, as part of that, engage and partner with reluctant communities who are reluctant to participate in the program, and particularly those that are hostile towards the program because they are frustrated that why do they only get repeated doses of polio vaccine and their other services are not being provided. So we are working with other partners, with the government, to make sure that they receive what Rotarians have always called polio plus, additional services to these very deprived communities. Contingency planning is ongoing in Afghanistan to make sure that regardless of how the situation evolves, we can maintain continuity of programming. New opportunities emerge sometimes when there is displacement due to conflict, where you can vaccinate children where they are concentrated, in displaced areas to make sure that they get services where they are. And then we have very active ongoing negotiations with Taliban to restore mass vaccination campaigns in areas under Taliban control. There are areas where children have not been vaccinated for more than 3 years. So it's a real situation of concern. And we can't succeed until we overcome this through our negotiations. And earlier this year, we have made strong progress. We've met with Taliban leadership, and there is ongoing follow-up on that on those meetings. There is, of course, a focus on mobile populations, both within countries, but also the massive cross-border movement that happens between the two countries. And we will continue to build on Polio Plus support, particularly now that it has become so important that we, in the context of COVID-19, we have to have the right humanitarian approach. We can't just go back repeatedly with the polio vaccine. We have to engage the communities with additional Polio Plus benefits through health camps, restoration of essential health services and civic services in these areas. I also wanted to talk about the impact of the COVID-19 on the polio program. So I think it is very, very important to realize that in Pakistan and Afghanistan and in other countries with weak health system, the polio program immediately pivoted because it became like the frontline public health response capacity in these countries against COVID. So the polio workforce, polio laboratories, polio surveillance network, the data management systems were really pivoted to support these countries' pandemic response. So, for example, in Pakistan, even now, every day, all of the COVID pandemic data on a daily basis is managed, analyzed, and presented at the cabinet level every morning by the Polio Emergency Operations Center in Islamabad. The surveillance officers in both countries have trained thousands and thousands of health facilities in recognizing and reporting cases of COVID-19 and contact tracing. So they've played an essential role in surveillance for COVID-19, and they continue to play that role. House-to-house distribution of leaflets, information, personal protective equipment in these two countries. So the polio team has really played a pivotal role in these countries' response and continues to play against the COVID-19. There was a 4-month pause in our region in polio campaigns. So across the region, not only just Afghanistan and Pakistan, 80 million vaccination opportunities were lost during that pause, affecting 50 million children, most of them in Pakistan and Afghanistan. And it allowed the expansion of polio virus transmission, particularly the type 2 polio that I showed you in the previous maps. There was some disruption in lab testing and specimen shipment because of movement restrictions, travel restrictions, flight cancellations. Now, I think this figure has been updated. Now we have more than 300 polio personnel that have been infected by COVID during their duties, both for COVID and for polio. And we lost 4 of our colleagues in our region, 3 of them in Pakistan and Afghanistan due to COVID because they were performing their duties. As I mentioned, campaigns resumed in July 2020 with specific COVID precautions, and surveillance is now improving, but it is not yet fully restored. In terms of new opportunities, just sort of what else is the GPI doing? So many of you may be aware that GPI is nearly finalized its new strategic plan from 2022 to 2026. The previous plan that was from 2019 to 2023 already became redundant because of resurgence of VDPV outbreaks, the pandemic. So a complete refresh of the strategy has been undertaken. This will be presented the last week of May to the World Health Assembly, the strategic plan. And basically, it has two primary goals. One is to interrupt wild polio virus transmission in Afghanistan and Pakistan. And the second goal is to stop all the vaccine-derived polio virus outbreaks across all the regions of WHO. Other opportunities, new opportunities are that, without going into technical details, the definitive and long-term solution for stopping vaccine-derived poliovirus type 2 outbreaks is to come up with a genetically more stable vaccine. And that vaccine indeed was developed, has been developed, it has received emergency use authorization by WHO, and it has already been rolled out for the first time in Nigeria already, and is about to be rolled out in Liberia. And this vaccine, which is called the novel oral polio vaccine type 2 vaccine, NOPV2, it will be increasingly becoming the important vaccine that will be used for a more definitive control of outbreaks caused by a circulating vaccine-derived poliovirus type 2. In our own region, given that we are now the last region with still endemic wild polio virus, the regional committee, which is a governing body of the World Health Organization made up of all the ministers of health, they passed a resolution in October 2020 to establish a specific regional subcommittee for polio eradication and outbreaks. And that subcommittee had its first meeting in mid-March. They elected the health minister you see here in the photo from Egypt as the co-chair of the regional subcommittee, along with the health minister of United Arab Emirates. And this really is to consolidate and solidify regional support and solidarity to mobilize political commitment, financial commitment to complete polio eradication and support countries that are dealing with either endemic polio, Pakistan and Afghanistan, and or outbreaks of vaccine-derived polio virus. So this would be a very strong platform of health ministers, together with partners, leaders of GPI partners who will be working with the governments in our region to mobilize collective public health action and political commitment to complete eradication. Now, I think I'm getting towards the end of my presentation, and this is particularly important slide for the Rotarians in Great Britain and Ireland. So global leaders pledged US $2.6 billion to eradicate polio at the Reaching the Last Mile Forum in late 2019 in Abu Dhabi. Within that, United Kingdom had announced that it would contribute more than almost 515 million US dollars to the GPEI. And UK has been a tremendous partner and leader in global polio eradication initiative, both for its leadership role internationally, but also UK provides GPI the most flexible funding, the least earmarked funding that really affords the program the agility, the resilience to respond to emerging challenges real time. UK recently announced that it is going to reduce its funding by 95%, which of course is of great concern given the important role that UK plays and its funding plays. And I think it is really important that as UK is coming out of a fairly hard-won battle from COVID-19 within UK, like the US and other countries, UK is also starting to look beyond its borders globally and is looking at how it can contribute to controlling the pandemic globally. And I think it is really, really important to recognize that a reduction in polio funding will also reduce the resilience and capacity of these countries, Pakistan and Afghanistan, others like Somalia, to be able to deal with the COVID pandemic. Because as I discussed earlier, the polio infrastructure, the workforce, the experience, the processes, they have been essential to these countries' COVID pandemic response. So UK's funding for global COVID-19 control is going to be obviously at a much higher level than the pledge towards global polio eradication initiative. That's only a fraction of what I think UK will be ultimately spending on controlling the pandemic. But I think cutting such a significant cut to funding for polio eradication would also compromise the ability of these countries to respond to the COVID pandemic, efficiently, and making sure that when the sufficient quantities of COVID vaccines become available, that citizens of these countries are able to receive these vaccines at a much larger scale that the polio program can help with. I know that many of the questions are around, how can Rotarians help? This is clearly an area where Rotarians can have a very, very important role to play. Rotary is the heart and soul of polio eradication. I'm quoting Mr. Gates here. And let me just sort of highlight 3 areas where Rotarians have a really, really critical role to play, given where we are in the program. The first, I've already mentioned, that advocating with your own governments, with your own parliaments and decision makers about restoring or even increasing funding to complete polio eradication, because it has impact not only on polio eradication, significant impact, we are so close to succeeding, but it also has impact on how these countries actually respond to the COVID pandemic, because the polio workforce is integral to their COVID-19 response. That's first and foremost. Second key element, the second most important thing Rotarians can do is to advocate with governments of Pakistan and Afghanistan at all levels, because they are so distracted by the pandemic, so that they really maintain also a focus on completing eradication. And that's where Rotarians in Pakistan, and we'll hear from Rotarian Masood Bhalli Saab as what Rotarians in Pakistan are doing. We need to support them in their efforts to advocate with the national and provincial and district authorities in Pakistan and Afghanistan. So that's extremely important. And I think the third area where the Rotarians can be helpful is about, there is so much misinformation around vaccination in social media and around the world. There are communities in Pakistan and Afghanistan that, as I said, are mistrustful of the program because they're displaced, they're conflict affected. And on top of that, they're also facing the barrage of misinformation from the social media. Rotarians have an important role to play in helping building trust of these communities with the polio vaccine and the vaccination program and polio eradication. So at a community level, you are the voice of civil society. I think you have an important role to convey and build confidence in polio vaccine and the polio eradication program. So I think I just want to, again, recognize and remember Rotary's promise that we are all working very hard to deliver on, is a world without polio. I want to thank all the Rotarians for their generous support, for their commitment and their involvement in the program. Thank you very much, and I'm happy to answer any questions. Back to you, Janine.
Thank you very much, Hamid. I mean, you've clearly covered an awful lot of ground there, and I think people would do well to listen to the recording when that becomes available, because there are so many elements to it. I am waiting actually for our second guest, who seems to have a problem occasionally dropping out, and he currently is dropped out from the system. In his absence, I would like to say who he is, because he is a Rotarian who, I do occasionally hear Rotarians saying, we've been doing this long enough, I don't want to do any more. Well, actually, this is a Rotarian who, since 1986, has been involved with the polio campaign in Pakistan. He is currently the chief zonal coordinator for the Sindh province. And, if he's not fed up with it, he is absolutely passionate about Rotary continuing our efforts to rid the world of polio in not just Afghanistan and Pakistan, but everywhere. So when he rejoins us, I will introduce him, and I'm sorry that he's not with us at the moment. But in the meantime, Hamid, we have got lots and lots of questions. So one of the ones that a couple of people have asked about, John Barrow from Bradford Blaze, is asking why is it that the Taliban have long been felt to be anti-vaccination, which you've obviously said is not the case. And Tony Sargent asks, can the vaccines be supplied to the Taliban for them to administer to their population? So I wonder if you could address those points.
Both are excellent questions. And I think we went through a phase of militancy in Pakistan where the Taliban on the Pakistan side were opposing polio vaccination. They're very different from Afghan Taliban. And as I was saying, is that we started the program. And in fact, I was in Afghanistan when we did the first set of trainings and set up the program, where I worked with the Taliban leaders who were in government at the time. Mullah Umar wrote several letters in support of the polio campaign. So as a matter of policy and philosophy, the Afghan Taliban have never been against polio vaccination. This recent ban started because of the geopolitical situation when a lot of drone attacks and air war intensified in Afghanistan around 2018, 2019. And they felt that the house-to-house vaccination posed a security risk. So it wasn't a decision made by their health people. It was a decision that was made by their security, their military people. They said that we cannot, they basically said that they were concerned. So now the situation has changed, and we have been negotiating with them, as I said. So we are optimistic that we will gain access back to those areas soon. Of course, we are entering a very uncertain phase in Afghanistan right now. And related to that, I think one of the mechanisms, one of the areas of negotiation is, of course, that on what terms do we hand over the vaccine to Taliban and make sure that actually all the children get that. And that's actually part of the active negotiation right now with them. We have always said that we will jointly select people who work in those areas because they have to be qualified, they have to be trained, we have to ensure as WHO that they are well trained and understand what they are doing. But we will select people with the approval and endorsement of Taliban. It won't be that WHO and UNICEF unilaterally select people and send them to Taliban areas. We can't do that. I mean, it's not even appropriate for their security. So this is what we are discussing, is that how best can Taliban take responsibility, but they do that in a partnership with us where we can assure quality and we can actually ensure and monitor that actually children are getting vaccinated.
Indeed. Thank you, Hamid. And I'm very pleased that Masood Bali is actually back with us. Masood, I introduced you in your absence, and I also pointed out that you haven't yet given up on the polio campaign, and you've only been doing it since 1986. So that doesn't give any of the rest of us any right to give up on the campaign. So Masood, from Rotary's perspective, can you just give us a few minutes about how you see the program, please?
Thank you, Dr. Jafari. I think has given you a very vivid picture of the situation. And I would only add a couple of points. It is good to hear that all environmental samples were negative for the first time a few days back throughout Pakistan. The second issue is the progress regarding missed children. Missed children have been a chronic problem, and one reason could be weak post-campaign follow-up. It is good to know now that a procedure has been put in where a separate meeting will be held after the campaign to only discuss missed children, which is very important. In this connection, I have only to submit that timeline should be followed. The campaign that ends, the omissions should be noted down very carefully, and before the next campaign, these omissions should stand rectified. This will hasten the process of covering vaccination and achieving our object of turning Pakistan free polio. At this stage, which requires quick follow-up. You see, we have reached a stage where you need a quick follow-up on all missions that take place during the campaign, and they, I think, need to be put down one by one that have been rectified in the second campaign, and there should be no repetition. I have to thank you for your support, and my appeal to Rotarian is that we are on the way to success, and we would need. We are very grateful in the country for Rotarians all over the world, which has been supporting this program, and we hope this support will continue until we lick the issue. Thank you very much.
Thank you very much, Masood. I would like to thank you and all your colleagues, your fellow Rotarians in country.
Can you hear me?
Yes. Yes, we can hear you, Masood. Masood's connection, unfortunately, doesn't seem to be very stable. But
is the connection
Masood,
gone?
Please pass on our thanks to all of your colleagues and to your teams.
Can you hear me?
Yes, I'm trying to mute you, Masood, because we can hear you, but you clearly can't hear us. Okay, let's move on with some other questions then, because Judith Diamond is actually asking about the withdrawal of the US and NATO troops from Afghanistan and the impact on the polio program. And you have covered that indirectly, Hamid. Is there anything that you can add to that in relation to the program?
No, yes, absolutely. I mean, I think, as I said, that the withdrawal of NATO and US forces, as you all know, has created an uncertain environment as to how the government of Afghanistan and Taliban whether they will reach a peace process, or how is it going to all unfold? And we don't really know the answer to that question. So what we are doing is what we call contingency planning, right from a fundamental of how do we maintain continuity of business operations within the UN, WHO, and UNICEF, but also to start preparing program continuity plans in the field, identifying key managers who are residents of local areas, pre-positioning vaccine in different parts of the country so that you never know where the front lines will be and where you still have an opportunity to vaccinate children, because the front line is not everywhere. There are always children and families living in areas where there isn't active conflict. So making sure that we have the logistical and operational resilience and flexibility to vaccinate children wherever they are. Also, sometimes these mass displacement provides an opportunity to vaccinate children in one place, whether it's, they are in displaced camps or whether they have crossed the border into Iran or in Pakistan. So we are working with those countries to be prepared that if there is going to be large scale displacement of population. We are hoping that none of that happens. We are hoping, of course, that peace comes to Afghanistan, but we are planning and building resilience for all different scenarios so that we are able to continue essential functions of the polio program. And number one is to maintain surveillance so that we don't go blind. We know where the virus is. We don't lose that capacity. And then secondly is to be ready to vaccinate wherever and whenever the opportunity comes up during a period of uncertainty.
Thank you very much. So let's hope that the plans don't have to be put into place too much, because it's going to continue. Just a comment for those of you, there's quite a lot of chat going on in relation to the UK government and the reduction in the aid situation from 0.7 to 0.5%. Please, if you haven't already dealt with the sample letter that was sent through the district governors from Judith Diamond, our advocacy advisor, please talk to your club presidents about that. But we will be talking about advocacy in our June session. So if you want to put any questions to Judith at that session, or in the meantime, if you put them in the chat to Judith or to myself, that would be fantastic. Thank you. Going back to Hamid and Masood, one of the questions that we're been asked in several different ways for this evening is in relation to that environmental sample that you talked of just now, and also you mentioned it in your slide. I mean, obviously the environmental sampling is really important for to track what is happening where and exactly where it's coming from. But with everything that's happening with COVID and with the instability, can we still be relying on those sampling processes?
That's a very important question. So I think there are two ways that we surveil for polio virus. One is the standard and primary mechanism whereby we ensure detection and reporting of all cases of acute flaccid paralysis. And then we test those persons to see whether the cause of flaccid paralysis is polio or not. So the laboratory determines that for us. The other way we look for polio virus is through targeted environmental surveillance, where surface water and primarily sewage is sampled regularly, because polio virus is excreted in stools. So that's a very important supplement to our acute flaccid paralysis surveillance strategy. And what happened during the pandemic, when the pandemic started, is that there was such disruption of health services that the reporting and detection and reporting of acute flaccid paralysis cases went down. And our program has been working very hard to restore that. And they have largely restored that. In some places, we have not come to the pre-pandemic level, but there is a very active program to restore that reporting. The second challenge was how do you move samples when there are such movement restrictions due to the pandemic? So we've been coming up with various mechanisms to be able to move samples, and are still working on that and have made important progress. And this is what we have to maintain. You know, in Pakistan, of course, the surveillance is improving. The environmental surveillance is quite extensive, so we are getting a very good picture of what's going on. In Afghanistan, also the environmental surveillance, we are going to be expanding that even further in Afghanistan. Now, if we get to a very bad security and conflict situation in Afghanistan, we expect that, you know, it may be that our, detecting cases in health facilities may be difficult. We will continue to make sure that our medical officers are visiting hospitals and looking for cases in those hospitals. But sometimes, just because of security reasons, patients are not brought to facilities. And that's where the role of environmental surveillance as a backup becomes very important, because that's where we are just looking in the environment whether if there is local infection, which can then be picked up by people who are excreting polio virus. So we have a sort of a two-track system that we will do, that we rely on, and we will continue to make sure that it has the resilience to continue to function during the pandemic and if there is a escalation in conflict in Afghanistan.
Thank you. One of the questions, or a couple of the questions, relate to a similar point, and you've covered part of it, but Sylvia Whitlock has asked, are there people who object to being vaccinated? And we know the answer to that is yes. And Lisa Cox, who's not a non-Rotarian, is asking, how do you encourage polio vaccination when so many people are afraid of immunization? And that also refers to the misinformation that appears on the internet and social media so often, and through other media. So your thoughts on that, please, Hamid.
Excellent question. And I think this is a question that has to be, almost everything in polio eradication, but particularly this question is so contextual. The answer is so contextual. We really, really need to understand what are the primary reasons in a given particular community why there is reluctance or even hostility towards polio vaccination. And we have to understand those reasons and then systematically address them. If this is because the primary reason is that it's become a bargaining tool to get other services, then we have a different approach to addressing that with local governments and other partners to, implement health camps, Polio Plus. Rotary in Pakistan is installing water filtration areas where there is no clean water, so that you build bridges with these communities. You also engage these communities, their leaders, to really build a partnership with them. We recruit frontline workers, especially women from the same community, so that there is trust, that we train them, empower them, so they go back and work within their own communities. And that trust also then helps if there is misinformation. they feel that, polio vaccine causes infertility, then if they're hearing from trusted channels, then we need to find those trusted channels so that they can work with the families to reassure them about the vaccine. We are tackling social media. The program in Pakistan has worked with Facebook and with WhatsApp to really appropriately deal with algorithms, so that each time you type polio vaccine, you just don't get a download of misinformation on polio. So there's a whole team created that, especially during polio campaigns, is constantly monitoring the social media trends and are immediately, counteracting any misinformation that starts to go viral. So the program has put those measures in place. So this is a very sort of a granular area of work where we are developing the program so that we actually have partnership. We listen to these communities. We don't just throw the program at them. We are actually listening to them. We are developing partnerships. So these communities become stakeholders within the program. Just creating awareness and telling them the information is no longer sufficient. If it was, we won't be where we are today. So I think this is a multi-pronged approach that the program is taking. But I think the most of the work has to happen within the program. It's easy to point fingers at the community, but I think as long as these communities are refusing, we need to do more to become one with them.
Thank you, Hamid. And I'm conscious that we're nearly at the end of the day, or the end of our session. I would like to ask Masood if there's a last message or call to action that he would like to give to Rotarians and others who are involved in this meeting. And in doing that, Masood, I would like to also highlight that, for me, I think as Rotarians, because we aren't in Pakistan and Afghanistan, many of us know people who are from Pakistan or Afghanistan, or have got family there, or have got business connections there. So Masood, what can we all be doing to help the situation and to help the things that Hamid has just said about connecting with the community? Because Rotary has got a voice. How can we use it?
I wish to make only 2 points. One is that, there are informal routes from Afghanistan to Pakistan, and there are formal routes. I think the informal routes need to be tackled under a revised program so that we don't miss these children. And this would help in coverage. And the other issue is, again, I would repeat that a mistake made in one campaign we should ensure that it is not repeated in the next campaign. Thank you very much.
Thank you very much, Masood. Hamid, have you got a last minute message for us or call to action you'd like to leave us with?
No, absolutely. And again, I want to really thank all the Rotarians who've joined this discussion today. And many of you, some of you are actually familiar faces that I've met in Rotary conventions before. I think I'm going to reiterate my 3 sort of points for call to action by Rotarians. And first is particularly talk to your governments. And this is especially relevant for Rotarians in Great Britain to look at. And Judith is leading this enormous effort. Please support Judith, work with her in making sure that there is recognition of the importance of UK funding and leadership in completing polio eradication, and the implication of this funding cut on polio eradication, but also its secondary consequences on control of COVID pandemic in Pakistan and Afghanistan and other vulnerable countries. So that's number 1 call to action. Please work with Judith. And if you're not in Britain and Ireland, please work with your own government to advocate for support for polio and polio funding. That's number 1. Number 2 is that please support Aziz and Masood in their advocacy efforts with governments at all levels in Pakistan and Afghanistan. Very, very important. Afghan Rotarians and then Rotarians in Pakistan, Aziz and Masood. Those governments need to hear directly from Rotarians, influential Rotarians, that this is an important priority. That's very, very important. Third is the question that Janine was just asking. You have a very strong voice as civil society. You're the only partner that's putting its time, its money into the program without, any paid member or getting anything in return. You have immense moral authority globally on this program. Please communicate through Rotarians to local communities, the diaspora of Afghans and Pakistanis in UK, in other countries. Talk to them, channelize appropriate information and support for vaccine through your contacts in the diaspora. I'll stop here. Thank you, Janine.
Thank you, Hamid. Thank you to Masood and Hamid for giving us such a great insight. I know that time is now up and we need to close. I would certainly be very happy to listen for another couple of hours because there's so many questions that we haven't yet answered. There's so many things that people want to know and I would definitely like to know. But thank you for giving up your precious time. I know, Masood, it's quite late at night for you there in particular. Hamid, not quite as late as it is for Masood. Recording will become available on the Rotary Great Britain and Ireland YouTube channel. There's a polio playlist on there. I will send you all an email to the address that you registered at for tonight with the details for the recording and also for the PDF, a copy of the PDF from the slides. The next session, we haven't yet got the date fixed for it, but it will be in June. And it will be specifically for clubs in Great Britain and Ireland on the focus of advocacy and using the power of the media and how we can actually use our voices practically and the enormous benefits that come from doing so. So Judith will be one of our key speakers and we'll have a journalist helping us with that as well. Everybody is welcome to attend that, but you will bear in mind that the focus will be in relation to Great Britain and Ireland, but that means many of the messages will also be appropriate for anywhere else you are in the world, and indeed with our families and our communities, and giving that message for countries there the polio immunisation work is so essential. So please, it's coming up to the end of our Rotary year. We absolutely need all of you who are in a position to make a donation, please do so. If you're in a position to encourage others to do so, please do that, because we need the money to continue this absolutely vital campaign. And for every pound we do not raise towards the $50 million that we try to raise each Rotary year to become 100 million extra from the Gates Foundation, for every pound we don't raise towards that 50 million, it's £3 we effectively are losing. So all of us can really make a difference. And you've attended this meeting, you haven't had to pay your petrol, so how about making a donation of your petrol costs? Thanks ever so much for all your time. Thanks ever so much for everything that you've all been doing for the polio campaign. Please keep up those efforts. And thanks once again to Hamid and Masood. And I hope we see you all in June. Bye.
Bye. Bye, everybody.
Bye.
Bye.
Bye. Thank you so much.
Bye-bye.